Well, thank you, Trevor, and thank you for all the marvellous work that CBET does, both in terms of its work as a research centre, but also in relation to the MA in bioethics and medical law, which I think is a huge success. So, of course, Matt is involved. Are you the programme director of that, Matt? Yes, okay. And of course, the journal, of which Matt is the managing editor, and Trevor, the editor, New Bioethics, which is a wonderful publication too. Yeah, I've said before in promoting this event that it's definitely not a research seminar, and I'm going to be somewhat polemical. And I want to raise a question, really, which actually I don't think ought to be a question, but in actual fact, the consensus seems to have coalesced around the opposite position from the position that I will take, to the extent that it seemed almost impossible to even talk about the question in polite company without facing a whole load of abuse. And so I'm quite prepared for that this evening, of course, particularly as your polite company. But it's interesting, if you replace the word education or hospice, if you replace the word healthcare by education or hospice care in that question, Christians would regard it as self-evident that the answer to that question was no. But if you leave the word healthcare in that question, it seems that most Christians in the West regard it as self-evident that the answer to that question is yes, and not only yes, but beyond discussion. And I want to at least put this issue into the field of polite discussion, if nothing else. Okay. So the National Health Service was once described as being the nearest thing we have to a national religion, I think by Nigel Lawson. And it certainly gets a lot of support from religious leaders, although that isn't actually what he meant. And it seems, in fact, sometimes to be deified by religious leaders. So the Anglican Archbishop of Canterbury, Justin Welby, said at his enthronement, "Slaves were freed, Factory Acts were passed, and the NHS and social care established through Christ-liberated courage." This was not an off-the-cuff remark or something that he said under pressure in an interview trying to defend or fly the flag for Christianity. It was actually his enthronement speech. Yet when the UK National Health Service was reformed, though it's true that there was some Christian support, it was said of its creator, Nye Bevan, that he was a man by Lord George Brown, a Labour Party contemporary politician. He said about Nye Bevan, he had a burning faith in whatever seemed good to him at the time, but outside politics he had no personal faith at all. And he was indeed an atheist. And in fact, the perspective of the Catholic Church on the NHS when it was formed is quite interesting. Cardinal Griffin, the Cardinal Archbishop of Westminster at the time, actually managed to negotiate an opt-out from the nationalisation of the Catholic hospitals. There simply weren't enough of them, or they weren't important enough really for it to matter to the government at the time. And Griffin said, "It will be a sad day for England when charity becomes the affair of the state." It was, in fact, the only significant opt-out of any part of the previously charitable hospital sector which was granted. So, in this talk, I want to open up a discussion on the appropriate Christian attitude to government policy when it comes to healthcare. And the context of the founding of an attitude to the NHS in the UK, I think, is useful, because it is actually at the extreme end of international models when it comes to ways of providing healthcare, and when it comes to considering the question of state intervention in healthcare. And Christians seem to have moved from the position that one of the prime duties of a Christian, I'll explore this a bit in a moment, is to actually provide healthcare, to the position that it's one of the prime duties of a Christian to campaign for the government to be the only provider of healthcare. And again, I want to sort of explore why that might be and whether it's appropriate. So before the Reformation, going back a few hundred years, the Catholic Church, the church really, because there wasn't any other church then, was the provider of healthcare. So St Bartholomew's, for example, a major hospital in London still today, of course, was founded by the Augustinian friars. The Augustinian friars are actually one of the major providers of long-term care for the elderly in the area in which I live. They're still very active. So the Augustinian sisters, I should say, not friars. Somehow St Bartholomew's survived the Reformation and of course remains today as a great London hospital. Another great London pre-Reformation hospital was St Thomas's, which developed as the first teaching hospital in the UK, also before the Reformation. And in England, in fact, there were 500 hospitals by 1500, and every one of these, as far as we can see, was a Christian church hospital. And this involvement in caring for the sick and providing hospitality for those in need was replicated right across Europe until the Reformation. The small hospitals for pilgrims sprung up in the West during the early Middle Ages. Hospitals and almshouses developed for lepers, pilgrims, the sick, the aged and the poor. Milan, Siena, Paris, Florence each had a large number of hospitals, and the Christian ethos was very evident in those hospitals. Santa Maria Nuova is still a major hospital in Florence. By 1500, it had medical staff, proper medical staff, doctors, pharmacists, and several assistants, as well as, interestingly, female surgeons. Not that common at the time. After the Reformation, there was an immediate disintegration of that system, and for many years healthcare went into serious decline. But the one thing, in fact, that Protestant and Catholic denominations shared, the one view that they shared, was that it was a paramount Christian vocation to care for the sick. So, after a time lag, the provision of healthcare built up again in all countries, whether they were dominated by Protestant or Catholic denominations, or a mix of both. So, some would argue, certainly those of a Protestant perspective might well argue, that the flourishing of medicine was actually facilitated after the Reformation by the philosophy of the Protestant denominations removing the distinction between the sacred and the secular vocations. So Jenner, Pasteur, Lister and many other pioneers of modern medicine were devout Christians. None of those Catholics, I don't think. I'm not entirely sure. John Wesley quite deliberately took a course in medicine so that as a minister he could help those who had no regular physician. And in 18th century Presbyterian Edinburgh was a great centre of medical progress. A huge number of hospitals were established by Christian foundations across Europe and also, of course, then later in the United States. So as such, when the National Health Service was created in the United Kingdom, amongst very many other institutions, a lot of the institutions that were nationalised were pre-existing Christian hospitals, although not, of course, as I mentioned, the Catholic hospitals, tiny in number at that time. Largely because the Catholic Church, after the restoration of the hierarchy, focused on creating schools and promoting education, which is why St Mary's exists. The Salvation Army, which was founded in 1865 by William Booth, no relation, provided medical care in impoverished inner city areas, as well as homes for women who had been induced into prostitution. So, to leave this section with a couple of up-to-date figures, there has been a move to much greater provision of hospital care, of health care in general in the developed world by the state, but still in many countries the churches, Christian institutions are significant providers. So in Germany, for example, about 1/3 of all hospitals are either Protestant or Catholic hospitals. In the US, about 1/6 of all hospitals are Catholic hospitals. Now, as might be expected, just as Christian organisations were the most important providers of healthcare when now rich countries were poorer, they're also the major providers of healthcare in poorer countries today. And in fact, the Catholic Church is probably the largest provider of healthcare in the world. If it has a competitor, it's probably the Chinese government. But I think the Catholic Church is probably the largest provider of healthcare in the world. It has around 18,000 clinics, 16,000 homes for the elderly and those with special needs, 5,500 hospitals, and 65% of them are located in developing countries. In 2010, the Church's Pontifical Council for the Pastoral Care of Healthcare Workers said that the Church manages 26% of the world's healthcare facilities. In some countries, various Christian denominations, not necessarily Catholic, are the major providers of healthcare. That's a mission hospital, obviously. In India, which is quite an interesting example actually, there are 1,800 Catholic hospitals and dispensaries in a country where only 1.5% of the population is Catholic. So in a sense, actions speak louder than words. The Christian contribution, the physical contribution to the provision of healthcare is still, and has been through the ages, enormous. And when it comes to providing healthcare, it's probably bigger than the provision by any government in the world. Now, this is not a coincidence. It's born out of the mission that Christians see themselves fulfilling within the world to minister to the sick. It's part and parcel of what a Christian believes he should do, whether it be helping the best he can the sick within their own family or actually pursuing a medical vocation. For the Protestants, for you, I've got a quote from the Bible, which Catholics may occasionally pick up, and for the Catholics, I've got a quote from the Pope, or the Pope Emeritus. So, as Jesus said, Matthew 25, "For I was hungry, and you fed me; thirsty, and you gave me drink. I was a stranger, and you received me in your homes. Naked, and you clothed me. I was sick, and you took care of me. In prison, and you visited me. Whatever you did for one of these least brothers of mine, you did for me." Pope Benedict, in his encyclical Deus Caritas Est, which was published in Christmas Day, I think, 2005, he describes how the early Christians were widely admired for doing something which was then totally countercultural, which was looking after the sick and the weakest in society. In other words, putting into practice the exhortation of Matthew 25. As Pope Benedict put it in Caritas in Veritate, as the years went by and the church spread further afield, the exercise of charity became established as one of her essential activities, along with the administration of the sacraments and the proclamation of the word. Love for widows and orphans, prisoners and the sick, and needy of every kind is as essential to her as the ministry of the sacraments and the preaching of the gospel. Justin Martyr, not Justin Welby, talks in the early 2nd century of the charitable activity of the church linked with the Eucharist. People made offerings in accordance with their means in order to support orphans, widows, the sick, as well as prisoners and migrants. The Christian writer Tertullian in the 3rd century relates how the pagans were struck by the Christians' concern for the needy of every sort. So that's the history. You know, it's totally interwoven with the fabric of Christian life for 1,500 years up to the Reformation, and then with a little break for 400 years after that, irrespective of denomination. The provision of care for the sick, medical care and so on, is as interwoven with the fabric of Christian life as we would expect education to be today. But things have changed. So what does healthcare look like in the modern welfare state? It's always dangerous to try to classify things, but it's probably reasonable to say that in most states one of 3 things has happened. In countries such as the UK, Canada would be another example, I think, the state has effectively totally nationalised religious hospitals and integrated them into a state-owned, controlled and financed system. So there is no, except that small number of institutions for which you have to pay entirely privately, and it is a small number of institutions, certainly as far as religious institutions are concerned, there is no real Christian input into the system at all. Secondly, and this is a model which is more common in continental Europe, and could easily enough have happened in the UK. Bevan wanted this particular interpretation of beverage. It was by no means a fait accompli that the UK moved in this direction, rather than the direction of countries such as Switzerland, Holland, Germany, and so on in the late 1940s. And in those countries, religious hospitals have the freedom to operate, but the state kind of controls the system architecture to ensure that nobody gets left out. Patients can choose religious insurers. You certainly can in Germany. Hospitals, care homes, and so on. And this is rather like, I suppose, our voluntary aided school system, where the state controls the system architecture, but parents can choose religious schools if they wish. There are definitely some analogies there. Or thirdly, the systems where the religious institutions and hospitals are pretty autonomous, but the state takes care of financing healthcare for the poor and possibly the elderly. In which case the particular special charitable role of the Christian hospitals is perhaps displaced, but their character in other respects remains. And the United States is maybe an example of that type of system. Now, I've already mentioned our Archbishop of Canterbury's praise of the UK National Health Service. And there is undoubtedly widespread support for that system in the United Kingdom, including amongst Christians, perhaps even especially amongst Christians. Even in the United States, though, there is some vocal Christian support for a UK-style system, although I've never noted strong support in continental Europe for a UK-style system, interestingly. One of the most prominent Catholic writers in that regard is probably Elizabeth Breunig, and this is her commenting on the NHS versus the US system. So she says, I was on the NHS, I assume that's when she studied in Cambridge, it ruled. My epilepsy medicine was free. In the USA, there's an entire network of charities devoted to nothing but helping people try to buy their life-saving seizure medicines month to month. And so she goes on to compare the UK system favourably to the US, where she quotes a children's hospital in Philadelphia as taking into account the cost of medicines when deciding what to prescribe. Now, of course, that happens in the UK, but it happens through a different mechanism and not necessarily on a hospital-by-hospital basis. The idea that the cost of medicines is not taken into account when deciding whether they should be part and parcel of what's delivered by the NHS is simply fiction. Now, one of the problems with these kinds of debates is that as soon as somebody opens a discussion, which maybe starts with them saying, I'm not convinced that the NHS is the best system in the world, or I'm not convinced that the NHS couldn't learn something from somewhere else in the world, the automatic reflex response is to jump on them and say, so you want people dying in the streets like they do in the US, do you? Now, putting aside whether that's a true reflection of the system in the US, which it isn't really, it should be borne in mind that there are other countries in the world, apart from the UK and the US, including a large number of countries in continental Europe, which have systems by and large different from both, and Asia for that matter. So where might the Catholic Church stand on this issue in terms of its social teaching, which again we apply quite a lot to subjects such as education, maybe not so much to healthcare? Now, I'm going to argue that the Catholic Church's view of these matters is such that a system with a single state healthcare provider, which effectively legislates out of existence all church providers, has to jump a very high hurdle if it is to have support from Catholic social teaching. So, the first principle that you might want to apply of Catholic social teaching is that of human dignity and the common good. And they demand, the Church has been very clear on this, that all must have access to healthcare. So the Vatican II document, Gaudium et Spes, stated, for example, the demands of the common good are strictly connected to respect for and the integral promotion of the person and his fundamental rights. These include the provision of essential services to all, some of which are at the same time human rights: food, housing, work, education, and access to culture, transportation, basic healthcare. So it's not possible to take a position, I don't think, informed by Catholic social teaching, which supports a system where everybody does not get access to healthcare in one way or another. That's not the question I'm addressing. I'm happy to totally support that. I've not seen any mainstream Christian view expressed really to the contrary. However, just because Christians believe, Catholics believe, maybe all Christians believe, that all should have healthcare, does not mean that the state should provide all healthcare, any more than that the state provides food for all, or all shelter for all. How healthcare is provided and financed should be a matter for prudential judgment, and we should consider the other principles of Catholic social teaching before reaching a conclusion. And I think this is probably the aspect of the talk which, if I had time, I would develop maybe a little bit further. I've just sort of, it's around the issue of, exactly what is the motivation, exactly what are the principles of Catholic social teaching which should and how that should govern, and how they should govern how healthcare is provided. So this is a bit tentative. So healthcare really was originally regarded as an act of Christian charity, I think it's fair to say. And that seems fairly clear from the quotations from early Christian times, from the Bible, and so on. It was providing out of charity, out of love, for those who had the misfortune to be sick. And in past centuries, people would have been sick and helpless really at the same time very often, and not necessarily with any prospect of cure, and really the Christian duty was just to look after people humanely. But in the modern world, I think healthcare is rather more complex than that, because it involves providing a set of services which can actually alleviate or entirely cure whatever it might be that's making us unhealthy. So it's not just about charity. It's not just about looking after a person whilst they are sick, providing for their personal needs and so on. It's more than that. And I think the provision of healthcare then can be related to principles of justice. So this includes distributive justice, ensuring that the goods of this world are appropriately distributed. And this involves, according to Catholic social teaching, that all should have access to healthcare. And also social justice. Social justice involves, in Catholic social teaching, an interpretation somewhat different from its secular meaning. It means that we all act in a way which promotes the common good of all society. And the Catholic Church would argue that the common good of all society can't be promoted unless if some go without healthcare. In other words, there should be no gaps in provision. All should have access to healthcare, which is to some extent repeating what I said in what is said in Gaudium et Spes. Importantly, I'd also add, though, that social justice demands that healthcare takes place in accordance with a Christian ethic, and that's an issue I want to park for now and come back to later. So you might think that if healthcare is the provision of healthcare is related to aspects of justice, then it should be the role for something like the NHS, it should be the role for the state to provide healthcare. We normally think of justice as being the job of the state in modern society. Well, that's a huge mistake in Catholic social teaching, and the Catholic social teaching would sort of trace back that error probably to the Enlightenment, when we sort of think about people having individual freedom in the context of a framework of the state, which sets a framework which governs contractual relationships and so on. The Catholic Church has a much richer understanding of social justice than that. And indeed, in the so-called social justice encyclical, that's the first papal encyclical which introduced the concept of social justice into Catholic social teaching, which was published in 1931, there is hardly any mention of the state at all in the sections which actually talk about and discuss the application of social justice. The promotion of social justice is the function of each and every organisation in society. And indeed, in the 19th century, as thought on this developed, the term social justice was explicitly coined in order to try to move away from the previously used term legal justice, which people had come to associate with the state. The Church wanted to make very clear that social justice is the responsibility of each and every one of us and each and every institution in society. And to hammer home the point, that same encyclical introduced the principle of subsidiarity, which demands, doesn't just suggest, it demands that the state should not do those things that can be done by other organisations in society. This is all perfectly consistent, I should add, with the principle of solidarity in Catholic social teaching. People often argue there's a tension between the two. I don't think there is, as this is in Caritas in Veritate, a social encyclical of Pope Benedict XVI, published in 2009, when he commented, I think, quoting John Paul II actually, that solidarity is a sense of responsibility on the part of everyone with regard to everyone, and it cannot therefore merely be delegated to the state. Now, this is not an anarchist argument. It's simply an argument to say that the responsibility, which I'll come to later, that the responsibility for the provision of healthcare and for an awful lot of other things which make society a better place does not stop at the state. It's for all of us and for all institutions in society. And the principle of subsidiarity also argues that where the state does intervene, it should assist other institutions in society and not simply take over their functions. So in the case of education, you could say that Catholic schools, they exist in a framework which is created by the state, they are funded by the state is helping them in their vocation, their mission to educate the children of those parents who want to avail themselves of a Catholic education for their children. There's also no reason, I should add, to assume that healthcare should necessarily be free at the point of delivery, although in most systems it is, even if the state is not a major provider. The insurance arrangements ensure that it is free at the point of delivery. There's no intrinsic reason why healthcare can't be funded by a mixture of personal contributions, insurance, charity, state finance, and so on. Other things which we regard as human rights, such as food, shelter, clothing and so on, are not provided free at the point of delivery. Now, it might be prudent, it might be good to provide healthcare free at the point of delivery, but not those other things. But there's no intrinsic reason why healthcare should be provided free at the point of delivery. There's lots of ways we can ensure that the less well-off have adequate access to healthcare, which don't necessarily involve providing free access for all. Now, these conclusions, I should add, are totally congruent with a pamphlet which was produced by a group of St Mary's academics a few years ago, of which you were one, weren't you, Trevor? The Plater Project, is that right? No, okay. No, okay. So Ashley Beck was definitely one of them. Now, when it comes to matters of Catholic social teaching, I have to be careful because I'm on film. This has been recorded. He might watch it. But you don't get. Ashley jokes about this himself, so I think I can say this. You don't get much further to the left than Ashley Beck, do you, Anthony? No.
That's true.
That's exactly actually what he wrote about because he was one of the co-authors of that pamphlet produced by a group of St Mary's academics a few years ago. So I think it's in that context that we should perhaps have a look at the results of the National Health Service. As I say, I think it's got to jump a system where the involvement of Christian institutions, or for that matter any other civil society institutions, are squeezed out to the margins, has to jump a pretty high hurdle before we say it's acceptable. So we can ask ourselves whether or not the National Health Service does jump that hurdle. Now, there's one study which is produced every year by the United States Commonwealth Fund, which is regularly quoted by advocates of the NHS on both sides of the Atlantic, which always ranks the United Kingdom, the NHS, very highly. Now, this study is designed, in fact, to rank systems which are single-payer systems without insurers very highly. It's not surprising that the NHS comes out near the top. So, for example, one of the questions asks whether patients have ever had disputes with their insurers. Well, I don't suppose you've ever had any disputes with your insurers when accessing NHS medicine, because there's no insurer. It simply can't happen. Another question asks whether patients make co-payments. Co-payments are illegal in the NHS system, in effect. So it simply can't happen. If the state finds a drug too expensive, it simply isn't provided. The study measures equity of access, under which, I'll come back to this in a moment, the NHS actually ranks very highly. But it would rank a system, and I'm not saying this is the case, but it would rank a system that gave everybody equally poor access above a system where there was unequal access, but everybody got better access than the access in the system where access was equal. But let's have a look at the last line, which some of you might already have spotted. When it comes to healthcare outcomes, there is one country which is worse than the United Kingdom, and that's the United States. All sorts of reasons for that, which I won't go into. And interestingly, there are two countries in positions 9 and 10, and they are the two countries which have systems which are identical to the National Health Service. Interesting actually also that Germany, which is a system I've kind of praised, doesn't come out that great either, although there's a pretty big gap, I should say, between Germany and Canada and the UK. Now, this situation led. This study is regularly reported on in the news media, and it led a Guardian, somebody who wrote an article in the Guardian, to write, apparently without any sense of irony, the only serious black mark against the NHS was its poor record in keeping people alive. Which is a bit like saying the only problem with the coffee machine is its poor record of making coffee. It looks pretty, doesn't use much electricity or whatever, but it doesn't make very good coffee. And in international comparisons of healthcare performance, the NHS almost always ranks in the bottom third of countries, on a par with countries like the Czech Republic and Slovenia and so on. And in a blind test, if you had to guess where the UK was, if you looked at the outcomes, healthcare outcomes, you would probably guess that it was a former communist country in Central and Eastern Europe. That's roughly where it sits in most league tables. You certainly never mistake the UK for Switzerland, Holland, Germany, or Belgium. And these stats suggest why. The UK's breast cancer, prostate cancer, lung cancer, and bowel cancer treatments. If you look at the let's start again. If the UK's breast cancer, prostate cancer, lung cancer, and bowel cancer patients were treated in the Netherlands rather than in the UK, about 9,000 lives a year would be saved. If they were treated in Germany, more than 12,000 lives would be saved. And if they were treated in Belgium, more than 14,000 lives would be saved. And a similar outcome exists for a whole range of other conditions, as well as more holistic measures of health system performance. In fact, the UK has one of the highest rates of avoidable deaths in Western Europe. In addition, the availability of drugs is more limited in the UK than in most other systems of Western Europe. And of course, one response to this commonly is that the UK NHS is underfunded. That's a complex question simply because of the way we account for health service spending. And there are lots of technical issues connected to that question. And there may be some truth in that, but actually the UK is roughly, in terms of health spending per capita, in the middle of the distribution in the Western world. It's certainly not obviously an outlier, whereas it is somewhat of an outlier in Europe, at least when it comes to health outcomes. Now, none of this is to say that the NHS is awful at everything. It keeps costs relatively low in accounting terms, as I've just indicated. It also provides equal access to a basic level of service, which is perfectly decent, at least in principle and largely in practice. But having said that, the equality of access, or at least theoretical equality of access, doesn't lead to equality of health outcomes. For example, infant mortality in Glasgow is nearly 3 times the level of the City of London, and life expectation at birth varies by 10 years between the poorest and the richest areas of the UK, and these differences are widening. Now, there are all sorts of reasons for this, and about 90% of improvements in life expectancy actually have nothing to do with healthcare. 90% of differences in life expectancy have nothing to do with healthcare. And I should say, you can't blame the NHS for that, and I'm not blaming the NHS for that. But all I'm saying is that if your dream is equality of outcomes, it doesn't produce it. But that's not to say if your dream is equality of access, then maybe you should be somewhat happier. But there are many other countries, Switzerland, Belgium, the Netherlands, Germany, who all achieve universal access to healthcare. And as I mentioned already, in Germany, the churches are huge providers of healthcare. So my first conclusion is that we should support a health system where there is greater, or Catholic social teaching at least, leads us to support a health system where there is a greater role for mutual civil society and Christian institutions, as well as potentially commercial organisations, than exists in our current model in the UK, and where the where individuals and families are able to make choices in accordance with their preferences. I'll come back to that at the very final when I really round up with conclusions. But I want to move on to another point, which I do feel, if you like, nails this argument. And indeed, even if everything I've said so far was not true, or even if the reverse of it was true, I think my next argument is at least as, if not more, important. I would argue that the provision of healthcare is inseparable from ethical considerations. It could be argued that this is becoming increasingly important, given advances, if that's the right word, in technology and so on. And it's also notable that the majority of healthcare interventions are either quite close to the end of people's lives or quite close to the beginning of people's lives. There's a rule of thumb, I don't know whether it's borne out by the evidence, but I don't think it's very far away, that 50% of all health spending is in the last 18 months of somebody's life. And so firstly, I think we should recognise the intrinsic relationship between medical practitioners and their patients, which is rather like the relationship between a teacher and a student. It should be one of total devotion from medical practitioners towards patients. Now, of course, there are many non-religious medical practitioners who are totally devoted to their patients, and you bet there are many religious medical practitioners, I'm sure, who are not totally devoted to their patients. But the concepts of vocation, love and sacrifice, I think, are intrinsic to the Christian calling, and I think it can be argued can best be practiced, or at least people ought to have the opportunity to practice them, in a pluralistic healthcare sector where Christian institutions are an integral part. Even if the state is financing healthcare, even if the state is providing a significant number of the healthcare institutions. Secondly, medical decisions often, if not normally, involve ethical aspects. And the monopolisation of medicine, and I'm going to use that word now rather than the socialisation of medicine, because monopolisation could come through monopolisation by commercial interests as well. I'm not sure that I'd like Facebook to be the only provider of healthcare in the UK any more than I'm keen on the government to be the only provider of healthcare in the UK. The monopolisation of healthcare can require people to pay for things that they find morally repugnant, whether it be abortion services, invasive fertility treatment, and possibly euthanasia. There may be people who are not Christian with a different set of moral values who may find other things morally repugnant, which they may think the NHS does, which it shouldn't do. So monopolisation in single-payer systems of providers of healthcare also prevents providers of healthcare putting a particular ethical perspective at the centre of everything that they do, whatever that ethical perspective might be. So I'm really talking about pluralism here, rather than necessarily talking just about Christian institutions. But in a Christian institution, you would expect a healthcare institution to put the protection of life from conception to natural death right at the centre of the way it provided care and so on. That might make it give a higher priority, say, to palliative care than to spending on all sorts of modern technology which may have other benefits in other contexts. So, by taxing people to pay for healthcare in a state-provided non-pluralist system, all but the very richest are prevented from making ethical choices about their healthcare settings. And again, that's something we would never countenance, or something that Catholics at least, and most Christians would never countenance when it came to education. In Britain, the one sector which has not been taken over is the hospice sector, and this is a Christian-inspired movement that cares for people as they approach death. And hospices are widely admired as they allow people to die with dignity in a way which is consistent with a Christian ethic. And so perhaps we should consider how that ethic could be extended into other areas of care. Now, let me now invoke Newman, who's up on the fireplace there, not just in the cause of Christian medical care, because he didn't really say anything about that as far as I'm aware. Indeed, he probably would have regarded it as self-evident that medical care took place largely in Christian institutions. I'm not 100% sure about that, but possible at least. But I'm going to invoke him in the cause of a Christian medical education. So Newman addressed Christianity in medical science in the last chapter of The Idea of a University. I'm sorry to say I've not read the chapter itself because I only relatively recently discovered that. I've only read a summary of the chapter, which was in a paper which I've read. And his case was really based on the Newman idea, indeed the Christian idea, of the unity of knowledge. So if medical education is done in a technical and secular context, he argued, biology will be at the apex of the discipline. If it's undertaken in a Christian context, he argued, medical science should be understood in the context of a Christian understanding of the human person. Bodily health, as Newman put it, is not the ultimate end of man. There's a higher law, and therefore the technical aspects of medical education would have been seen in a much wider context, at which the biological aspects were not at the apex, were not at the top. And if that higher law is invoked, then medical practitioners may well come to different conclusions about how to provide healthcare in particular situations than if purely utilitarian considerations are paramount. Of course, we know that's the case because it's the heart of many debates between Christians and others in relation to ethical issues in healthcare. But Newman is arguing that if these things are important in the practice of healthcare, then they should also be important in the provision of medical education. In other words, there should be such a thing as Christian institutions of medical education, something which there isn't, of course, in the UK. If we have something to offer in Christian institutions to the education of maths teachers, history teachers and so on, doesn't that apply in spades to the education of medical practitioners? And I should add that this ethical viewpoint, I think, would be valued by society as a whole, just as Christian schools are valued as a society as a whole, and not just by Christians. And hopefully, I hope that Catholic universities are also valued by society as a whole, and not just by Catholics, given that the majority of staff and students at this university are not Catholic. Maybe that is even self-evident. And actually, it's worth noting that not only are Christian hospitals different in their character from non-Christian hospitals. We don't have that many examples in the UK, but there are a few. That actually different Christian hospitals are different in character from each other. There was a paper looking at Protestant hospitals and Catholic hospitals in Germany, and the Protestant hospitals are good at and focus on different things from the Catholic hospitals, which arises from their different tradition and understanding of the importance of different aspects of ethics in the practice of medical care. Okay, so to conclude. Okay, there's much to debate, and in that debate I only want to rule out two extreme positions. One of those extreme positions I'm sure is pretty uncontroversial unless there are any anarcho-capitalist libertarians in the audience. The other of those positions is no doubt very controversial, possibly even amongst this audience. So the first position that I would say is ruled out by Catholic social teaching is the idea that anybody should be allowed to go without healthcare. That one way or another we should ensure, whether it be through charity, civil society institutions, church institutions or government taxation, one way or another we should ensure that all have access to basic healthcare. I don't think that's likely to be controversial in this audience. The other position, which I don't think is acceptable, is that all healthcare should be provided and financed by government. As you probably gathered, I'm not a fan of that position, and I think it is an extreme position, and I think it's a position which is ruled out by reference to Catholic social teaching. There's at least one Muslim in the audience. I'd be interested to know what his tradition thinks on this matter. But between those two extremes, there's a very long line. I think lots of things we can argue about and discuss, and there's a great variety in practice between different countries in Europe, the United States, Asia, and so on. But not many of those countries actually follow the same model as the UK model. Indeed, Christian social thought, just to really sum up, calls attention to the person in his or her totality: physical, emotional, social, intellectual and spiritual. And in that context, I think it's interesting to note that the word health has its roots in the Old English word health, meaning wholeness, being whole, sound or well. It's not just about the mechanical aspects of being well. And healthcare should be about the whole person and not just about the provision of a technical service. And I think it's impossible for a health system that is completely dominated by state bureaucracy to properly recognise that. And at the same time, just as Christians should point out that the state shouldn't monopolise healthcare, it's also the responsibility of Christians individually and institutionally to ensure that we're not leaving a vacuum that is too easy to fill. As I say, just as education in the 21st century is regarded as a clear aspect of the Christian vocation, otherwise a third of our university is devoted to teacher training still. The same should apply to healthcare, and does in many countries throughout the world. So I'm going to end this talk with a rhetorical question. Why is it that we regard Catholic education so zealously, and regard the right to provide an education to our children in a Catholic school as a fundamental and inalienable right, and we'll go on the attack if ever that right is chipped away, and yet we seem to regard the provision of healthcare in a Christian context with total indifference? And it seems to me that we need to open up and contribute to that debate, because I don't think there's any satisfactory answer to that question. Thanks.